Well, it is a disease that affects millions of people, but there is hope for those with Crohn's disease and the pain that comes along with it.
Joining us now is Dr. Ashraf Hanna, Director of Pain Management at the Florida Spine Institute, along with his patient, Aaron Greenberg. Welcome to the show, gentlemen.
Thank you.
Now, Aaron, tell us about how it was going through Crohn's disease and how it affected your law practice.
Sure. After about 16 years ago, I was diagnosed with Crohn's disease, and I tried all conventional treatments ranging from Remicade to biologics and all other immunosuppressants. And I had suffered from dangerous allergic reactions and side effects, including liver failure. And it had gotten to the point where I was in severe chronic pain 24/7 and had to rely on opiates just to have one meal per day. After having emergency surgery 1 year ago, I had about 1.5 feet my intestine removed, and the Crohn's disease had come back worse than prior to the surgery, and my options were limited to either going back on the same unsuccessful treatments that had caused liver failure, or risking having multiple surgeries again. I got to the point where my health deteriorated so bad that I was forced to resign from practicing law in my 5th year of practice.
Wow. So how did the IV ketamine work for you? Like, you found this treatment, how was that different than the other treatments that you'd done?
Well, the IV ketamine treatment with Dr. Hanna, I started it, and after my 3rd day of the IV ketamine treatment, I was no longer in severe chronic pain and no longer needed to take opiates. And I felt better than I have in over 20 years.
Wow. Well, it's got to be nice to hear these success stories.
Absolutely.
I know we've talked over the years from everything from Lyme disease to depression, fibromyalgia.
Yes.
Why IV ketamine for Crohn's disease? How did that come together?
Well, Crohn's disease is an immune-mediated chronic inflammatory bowel disease. You know, patients complain that affects the lining of the intestine. Patients complain of severe abdominal pain, diarrhea, even bleeding. So since I had great success using ketamine for other immune-mediated diseases like rheumatoid arthritis, multiple sclerosis, I thought I'll give it a shot for Crohn's disease.
Yes. And what were the results after you treated Aaron with Crohn's disease with the IV ketamine?
I mean, I want to be clear, I'm not a gastroenterologist. So I will only use ketamine for Crohn's disease patients if they're referred by their doctor, and they have to have tried and failed all other conventional treatment modalities. I definitely believe ketamine is a major medical breakthrough for Crohn's disease. It's the first case in the medical literature that a ketamine or any other drug have significantly reversed the inflammation and symptoms of Crohn's disease in such short period of time. Aaron's case was very severe. He was about to have another surgery, and he had an amazing result. He has a significant, remarkable recovery.
And what are some of the other conditions that you would treat?
So many.
So many conditions that you would treat IV ketamine.
I've been using ketamine now for about 5-6 years, over 8,000 infusions. Had great success with many conditions. Of course, first one was complex regional pain syndrome, then went to fibromyalgia, then definitely treatment-resistant depression, post-traumatic stress disorder, great success with chronic Lyme disease, as well as rheumatoid arthritis and multiple sclerosis.
Wow.
Wow, you've had a lot of success. And like you mentioned, there are these other conditions as well. So is there a place we can go to get more information, obviously?
Yeah, I mean, I work at Florida Spine Institute. You can go visit ivketamine.com and just call my office. I'll be happy to help any patients.
All right, well, congratulations to you. Thanks for spending some time and sharing your story today.
Absolutely. For more information about the Florida Spine Institute, visit ivketamine.com or call the number right there on your screen.